This is JS. She's a 45-year-old investment banker with 2 kids. Despite the smile on her face, she just divorced her husband of 25 years. Even though JS loves her kids, she suffers from chronic stress on a daily basis. Due to the nature of her job and life circumstances and stress, JS has resorted to unhealthy habits. She frequently eats Dunkin' Donuts and drinks Coca-Cola. Despite her doctor's advice, JS continues to indulge herself, resulting in increased hypertension. Today, JS came to work at 6 a.m. It's lunchtime and she's enjoying her 4th donut of the day when all of a sudden she feels lightheaded and dizzy. JS is experiencing a stroke and falls to the ground. JS undergoes routine examinations and doctors have not found any abnormalities besides a minor bruise.
Your vision is fine, your speech is fine, and you don't seem to have any noticeable motor impairments. We're going to discharge you, JS.
That's great. I really need to get back to work. Thank you, doctor.
Days after JS was discharged from the doctors, her children began to notice that she was acting differently.
Patricia, where are you? Patricia?
Mom, I'm right here.
Oh, there you are.
Has trouble recognizing faces that were once familiar to her, like her children.
Mom's acting strange. Remember when she walked right by me?
JS also has difficulty recognizing her coworkers.
Hey, JS, how was your weekend?
Oh, hey, you. My weekend was fine. Thanks.
JS is also experiencing alexia. When she reads, she has trouble recognizing letters, let alone reading whole words. JS starts to feel frustrated. She no longer is able to read her favorite novels. Because of her symptoms, JS goes to see a specialist.
Doctor, I'm having trouble reading words and letters, and I can't seem to recognize my coworkers' faces. I sometimes have trouble recognizing my own children's faces. Is there something wrong with me?
That is very odd. I'll order an MRI for you. From the MRI scan, it seems as though you have suffered from a bilateral lesion in your fusiform gyrus. The right side, specifically the fusiform face area, FFA, is responsible for face recognition. And the left side, specifically the visual word form area, VWFA, is responsible for visual recognition of words. Damage to both of these areas is what's causing you to experience 2 conditions, pyralexia and prosopagnosia.
Oh, no. Is there anything you can do to treat my condition, doctor?
First, I need to rule out aphasia and any other visuospatial function impairment, so I need you to take a neuropsychological test. Now we're going to take some diagnostic tests to measure how severe both of your conditions are. For alexia, we will use the iLink 1000 eye tracking system to measure your visual processing of words. Single words will be presented to you, and they will gradually become longer. We will be measuring your response time for each word.
Usually people with pyralexia have very slow reading rates, but because they employ the letter-by-letter strategy, they can eventually figure out the meaning of what they are reading. During her alexia diagnostic test, JS was able to spell out single letters but found it increasingly difficult as the words became longer. Even with this letter-by-letter reading strategy, JS sometimes found it difficult to discriminate letters that are very similar.
For your prosopagnosia, we will be using the Cambridge Face Memory Test. I need you to study these 6 unfamiliar male faces. Then, you will be asked to identify them among distractor faces.
During her prosopagnosia diagnostic test, no hair or clothing was visible for the 6 male faces. JS was able to correctly identify 34.72% of the faces. Her performance was significantly outside the normal range.
It seems you're suffering from severe pyralexia. We will use a letter-by-letter reading strategy called tactile kinesthetic treatment. Come back next week, and after some improvements, you will be asked to read briefly presented words out loud. In addition, you will be asked to decide if a spoken word was the same as the visually presented one. We will combine this treatment with the multiple oral rereading strategy. You will need to practice these methods at home at least 3 times a day for at least 6 weeks.
Sounds good. But what about my prosopagnosia? Is there any way I can treat that?
Unfortunately, there is no definitive treatment. We will have to use compensatory methods. You will be directed to pay attention to and verbalize distinct facial features, such as size of mouth and shape of eyes. Afterwards, we will use semantic processing by pairing your coworkers' faces to their jobs and life story. Next, you will be taught how to recognize common facial expressions, such as anger. We will use flashcards to help you practice recalling each expression. Don't worry, JS. All of these strategies will help you maintain your professional and social life. You should be able to adjust to your normal life in a couple of months.
Thank you, Doctor!